Assalamu alaikum and welcome to our ICON 2022. I'm Dr. Saima Saeed and a pulmonologist here at the Indus Hospital and Health Network. And I want to welcome my esteemed colleague, Dr. Ziauddin Islam, who's a public health physician, a respected tobacco expert in Pakistan, having led the tobacco control cell for many years. Together, Dr. Zia and I are going to moderate today's session, where we will take the next couple of hours to go through a really key issue, and that is of tobacco control policies. And we hope that we can sensitize our medical community about this really crucial issue. Because as we know, tobacco causes cancer, and we've known this since the 40s. But because we haven't controlled the usage of tobacco within our communities, it has become the common denominator for almost all non-communicable diseases and cancers, and kills 41 million people worldwide every year. So just to put that into perspective, with the COVID disaster at the moment, 5.5 million people have lost their lives. And yet we're looking at 41 million people a year who lose their lives from NCDs. So at the Indus Hospital, we have taken not just a clinical view on tobacco control, but have a broader approach to this issue, and have set up a particular project called Voices Against Tobacco, which is there to represent the most vulnerable groups and allow them to become ambassadors and advocates for tobacco policy reform. In particular, we focus on children, and in the last few months have looked at how we can engage with schools, allowed them to understand tobacco control issues and speak about them in fora which include policymakers. You can see a lot of our work on media platforms such as Twitter, Facebook, and Instagram. But today's session is more than just us. It's to welcome our partners and collaborators and other experts in the field to consider perspectives from all points of view when it comes to tobacco reform policy. So I want to invite our first speaker, who has pre-recorded their session. By the way, a quick note, all these sessions all the talks are pre-recorded, which is excellent, but hopefully we will have some of the speakers join us in a Q&A at the end. So what we will do is collect your questions throughout the session and then discuss them in the Q&A at the end. Additionally, please remember that the ICON sessions are approved for CME, and so if you would like a certificate, you must submit a feedback form. So without further ado, let me please introduce Dr. Shahzad Ali Khan. He's an esteemed professor of public health and has been raising the profile of public health throughout the country as the Vice Chancellor of the Health Services Academy in Islamabad. He's a strong tobacco control activist, and so today we'll set the scene for us through his talk on the changing tobacco control landscape in Pakistan. Thank you, and take it away, Professor Shahzad.
Shahzad Ali Khan, and we are here to talk about a public health response to COVID-19 beyond the call for duty. If you see Pakistan health system, the health was already in an emergency and disaster condition. Why I said this, that we were in a disaster because of a huge load of this risk factors of disease and the disease itself. If we see, we have a very high burden of people who smoke in any form, tobacco in any form. There is a very low percentage of people who eat healthy, like less people taking vegetable and fruit, and very few people, in fact, taking salad and vegetable. A very high proportion of Pakistan is inactive in the leisure domain, which means that there is a problem in physical activity, a very, very big problem for Pakistan. We have a very high proportion because of the above three, four risk factors. The overweight population is on the rise. 1 in 5 Pakistani was found to have a very high level of cholesterol and even they didn't know about their condition. So it is a silent epidemic of hypercholesterolemia creeping in, and the numbers are increasing every day. The recent surveys have shown even much higher population having high level of cholesterol, much above than 20% baseline figure which we had around 10 years ago. 1 in 4 Pakistani above the age of 18 years is hypertensive. 1 in 3 Pakistani above the age of 40 years is hypertensive. So it's very, very highly prevalent, and it's again called as a silent epidemic of hypertension, which results in a lot of issues of cardiovascular disorders. This hypertension leading into much more aggressive form of heart diseases. Very high proportion of diabetes, 12% to 16% are the various figures quoting the prevalence of population level of diabetes, all forms. Recently, a Punjab survey in Punjab showed around over 9% people suffering from hepatitis C and 4% people suffering from hepatitis D. Diarrhea is also present in 1 in 5 children in the last month. Which children, by children we mean children from 0 to 5 years of age. Anemia is another big disaster. Half of the pregnant women suffering from anemia, and there is a very, very big concern of the increasing number of TB. We are now 5th and soon to become number 4th in the world for largest number of TB cases. Pakistan is ranked number 3 on the maternal deaths, and we rank on a very high level for the neonatal mortality rate, and we are one of the last polio endemic countries. So this gives you a very, very brief picture of what are the various lifestyle risk factors which are there. If you see the nutrition indicators, other than health indicators, the nutrition indicators, which are basically the cornerstone of most of the diseases, whether infectious diseases or non-communicable diseases, the determining factor in many diseases is malnutrition. So stunting is very high, underweight, wasting, anemia in children. Now the initial lines are all about these under 5 children nutrition indicators, and then we have anemia in the women as well. So very high level of nutrition, malnutrition, and very low level of coverage for nutrition. And due to these, there are disabilities in the children as well. In women, you see there is around 44% of women who have anemia, and around 80% of the women in Pakistan have been found to have a vitamin D deficiency. So this is a very, very serious state of affair. Even before the COVID, the indicators of 2018 showed us a lot of risk factors. Response, how do we respond? We have a double system, mixed health system. Public sector has a very, very big infrastructure of health services, healthcare system, but low coverage. And even the HR is very high, but the presence of HR in most areas is still suboptimal. Most of them, the doctors and nurses, are concentrated in the larger metropolitan cities and big districts. The periphery does not have much of the HR as well as hospital beds. Private sector is another very, very large. They are also very large, but they are mostly unregulated, and we are trying to do some regulations for the private sector to increase the quality of care. Majority of the Pakistani population, they go to private sector, and very few go to the government sector because of these above issues. Out-of-pocket spending in the private sector is almost 89-90%, and in the government sector also, they need to get some medicine and investigation from outside. We have a double burden of disease, a very high communicable disease, and then a very high non-communicable disease. That is another dilemma. The reason behind this mixed health system syndrome and problems of this is one of the area is we have a very, very poor health financing in Pakistan. The financing in health sector is very, very low. If you see the human development indicators, Pakistan ranked 150th out of 189 countries, which is very poor. The general government health expenditure is less than 10% of the total government expenditure. The majority of the expenditure is by the private sector, and it is out-of-pocket spending. Donor share is also very less. People think that Pakistan is donor-driven, but no. Very few people know that the donors have only 1.7 and less than 2% share in expenditure of health. Per capita health expenditure in Pakistan is only $45 per person per year, as compared to Sri Lanka having $127 per person per year, $75 per person per year in India, and $50 in Afghanistan even. So you can imagine how less the health expenditure is there in Pakistan. The health expenditure as percentage of GDP is again very low. It is 1.1% as it was noted in the last 1 year. On the other hand, Afghanistan has 9.7% GDP going to health, 3.6% GDP of India is going into health, 3.8% of Sri Lanka, and 2.4% in Bangladesh. So if you see all of these above, you see the input level indicators in financing, in HR, in hospital beds, and everything related to the health service delivery. We have a problem of inequity. Some services available in big cities and majority cities are lacking in many services. And if you see the financing also, we are not even compatible to the neighboring countries and even the poor countries. So this is a backdrop where we wanted to say, how can we respond to COVID-19 beyond the call of duty? So this is my last slide, which will give you an overview of how we did in this COVID-19, and this is something very interesting that if you see, we started this journey of COVID-19 on 26th February when the first case were reported in Pakistan. And then when the first peak started increasing, we started a prevention system by the name of Testing, Tracing and Quarantine, TTQ. It was launched. The masks were made compulsory within the month of April and May. And SOP compliance was one of the national level, sort of you can say, national level strategy for control of this corona COVID wave, first wave. Ultimately, at the peak of the first wave, the hotspot lockdown was expanded. So majority of the hotels, majority of the restrooms, and majority of the parking places were blocked. They were closed. The first wave closed down by August last year, and then the next was, of course, we did a lot of indoor stuff, indoor marriages and other things, and then schools were closed also in last year, in 2020 in the November, and then we had a vaccination in last year in the month of January. So the COVID vaccination was a good thing in February 2021, which actually helped us. That you can see the next waves were not that high at a higher level. The second was very low, the third was again very high, and the fourth wave was also higher. So if you see the NCOC was one of the most important things happened in COVID-19 in Pakistan, where they immediately sat together and all of them they decided on what to do, and non-pharmaceutical interventions were one of the most important one. So what we have done so far is, whenever there is a surge, whenever there is a higher level prevalence of cases, what we do is we tend to do smart lockdown. The area closed down where there is a surge of cases. There is a closed days for markets. There is a less attendance into the offices, the 50% one. And in some areas, there is absolutely like a curfew situation. And in the three waves, we have done that. Currently, what we are facing is that we are actually having this very important, this concept of this new thing coming up in the form of Omicron. So what we have done now is that we have also started this smart lockdown in Karachi, because Karachi is mostly affected. And we are hopeful that by increasing the vaccination drive, the vaccination is the key, and Pakistan has done marvelous job in expediting the proportion of vaccination. We started a little bit late because of the supply of vaccines in global level, but we immediately got first the Chinese vaccine and then the US and UK and other vaccines through this Gavi and other WHO supported things. So we have enough stock of vaccine. Now we are moving for a mass media campaign for improving the uptake of vaccine, and hopefully we are very hopeful that if we increase the vaccination coverage up to 70%, which is currently reaching around 50%, if we reach by 70% by the mid of this year 2022, we are hopeful that the complications and the admissions and all other the rates of mortality and other will go down. And Pakistan, by the way, if you see, Pakistan has had a very low mortality rate of COVID-19 due to a lot of reasons. One being a very, very young population. Number two, mostly rural area residents, open area residents. And number three, smart lockdowns and a timely intervention of the NCOC, where the mass gatherings were avoided. So wherever there is a mass gathering, there is a very super spreader event. So we tend to do not limit the movement of an individual. We, in fact, moved towards the prevention of mass gatherings, which was very well controlled and maintained. Individual movement was not that much of a problem, and we kept on open for that, and so the economics didn't suffer much. So that is all from my side. I think the COVID-19 has given us a very important lesson, that even when there is no treatment, even when there is no vaccine, there are public health responses which one can easily undertake and one can easily do in order to save lives. And Pakistan has actually proven that it will be, even in any case where there is some technological or curative bias not available in the country, prevention is far better than cure. And Pakistan can, if there is a consolidated effort, Pakistan can definitely show the resilience and come out beyond the call of duty for anything for the nation. Thank you very much.
Okay, well, that was Professor Shahzad Ali Khan from the Health Services Academy talking about the COVID responses. We appreciate that he has set the scene in terms of the health financing and the COVID pandemic that we are faced with at the moment. So I'm just going to hand over now to Dr. Zia, who is currently in Islamabad and has joined us live.
Hi everyone, thank you Dr. Saima. Since tobacco use can be used in different form, one of the important form is combustible, like we use cigarette as a burning form, but other format is using as a smokeless form of tobacco use. According to WHO Global Adult Tobacco Survey held in Pakistan in 2014, which found there was 9.6 million smokeless tobacco users exist in Pakistan. To discuss this smokeless aspect as addressing smokeless tobacco, do we need a paradigm shift? I would like to invite Professor Kamran Siddiqui, who is a global public health professor and at the University of York, UK, an honorary consultant in the public health medicine at Public Health England. He is basically an academician working as a pulmonologist, epidemiologist over there, but he is a keen interest in having studying research in tobacco, TB diagnosis, and smoking cessation. So I would like to invite Professor Kamran Siddiqui to address smokeless tobacco.
My name is Dr. Kamran Siddiqui. I'm a professor in global public health and I work at the University of York. It's a pleasure to be here, although virtually, in ICON 2022. I'm recording this presentation to share some of my own research and interest in an area of huge importance to the region of South Asia and to Pakistan. And the topic here is smokeless tobacco in South Asia. And my question to you all is, do we need a paradigm shift in our thinking, in our approach, in our actions? The topic of smokeless tobacco, I'll be covering a number of areas. I'll be talking about the health and economic impact of smokeless tobacco. I'll be looking at health disparities and the recent trends over the last 2 decades in South Asia particularly. I'll be focusing on the youth uptake, the uptake of smokeless tobacco in young people. And I'll also talk about perhaps the single most effective intervention to control tobacco, that is increasing taxes on tobacco. I'll talk about the smokeless tobacco products, and doing that, I'll talk about the manufacturing, marketing, and sale of these products, and also how to regulate and control this manufacturing, marketing, and sales. And finally, I'll be talking about smokeless tobacco cessation, which is helping people to quit smokeless tobacco use. I hope in the background you can see a world map, which is shaded in terms of the prevalence or use of smokeless tobacco in the world. And the darker the shade is, the higher the prevalence is. So you can see that clearly many countries in Southeast Asia and parts of Africa, smokeless tobacco is highly prevalent as compared to other countries. But you can also see that smokeless tobacco appears to be a global problem, and it is there in almost every continent, and it's prevalent, in fact, in more than 140 countries in the world. So it is a global problem. Talking of a global problem, what is the global burden of smokeless tobacco? There are 274 million users of smokeless tobacco, not just tobacco, smokeless tobacco worldwide, which is almost a quarter of all tobacco users. As you can see from this bar chart here, with blue and red shades, that 90 or more than 90% of smokeless tobacco use is by people who are living in low-income countries or low and middle-income countries. And if you look at in terms of continents, then the region Southeast Asia covers almost 75% of smokeless tobacco use in the world. So this is about 228 million users in this region alone in South Asia. Why are we worried about smokeless tobacco use? We are worried about it because it causes devastation to human lives and the economy. And it does so by causing oral, pharyngeal, and esophageal cancers, a lot of head and neck cancers, essentially. And the mortality due to these cancers is very high, almost 70%. So as a result, thousands and thousands of people every year loses their lives because of these cancers. And it is all down to smokeless tobacco. If we look at the other conditions, then it's not just the cancers, but also ischemic heart disease, which also is led by smokeless tobacco use, and a number of people die as a result of smokeless tobacco causing ischemic heart disease and stroke. In terms of the economy, 26% of the economic loss to tobacco is down to smokeless tobacco. And this happens as a result of not just the indirect effect of smokeless tobacco related diseases when people stop working and stop contributing to the economy, but also directly because of the healthcare cost of people developing heart disease, people developing cancers, and spending not just the state money, but also their own money, and the money that could have been spent on education, food, housing, and other essential commodities. Now let's zoom into South Asia and look at the smokeless tobacco use in South Asia. And when I'm talking about South Asia, I'm talking about 3 countries in particular, that is Bangladesh, India, and Pakistan. In terms of the prevalence, all 3 countries have high adult smokeless tobacco prevalence. And you can see that if you add up these numbers of people using smokeless tobacco, that constitutes almost 75% of the global population that consumes smokeless tobacco. And in Bangladesh and India, you can see that smokeless tobacco is the predominant form of tobacco use. In Pakistan, also 40% of tobacco is consumed in the form of smokeless tobacco. So it's a major problem. But as you might have seen in the definition in the previous slide, smokeless tobacco is not just one product. It's actually a myriad of products consumed in South Asia. And not only there are differences between countries, but there are differences within country. So as you will see from here, I've drawn these charts to show how the different products are consumed in each of the 3 countries. Now, I'm not going to talk about India and Bangladesh in particular. You can see from these slides that there are different products that are common there. For example, in India, it's khaini and gutka. In Bangladesh, it's zarda with pan. But let's focus on Pakistan. What is the most predominant smokeless tobacco product that is consumed in Pakistan? And by all means, it is Naswar. We often assume that Naswar is only consumed in the KPK province of Pakistan, but that is not the case. It is consumed in other parts of Pakistan as well, Punjab, Sindh, and Balochistan, as well as KPK. And that's why it constitutes 60% of smokeless tobacco consumption in Pakistan. And then, of course, pan with tobacco is there, 16%, and then several other products, including gutka as well. There's another rather sad aspect of smokeless tobacco use, that most of smokeless tobacco consumption is concentrated in people with poor education, people who are poor generally, have poverty, and people who live in rural areas. So this also means that this is going to cause health inequalities, because if the problem is concentrated within masses that are less educated, less wealthy, less affluent, and living in rural areas, then you know that they are going to get more cancers and more heart disease as a result. And therefore, that is going to increase disparities between those living in cities and villages, between those with more wealth and less wealth, and between those who are more educated and less educated. So smokeless tobacco, even more than cigarettes, increases health disparities. I think this is something that we should remember, that addressing smokeless tobacco means that we are addressing health disparities between the disadvantaged communities and disadvantaged populations and affluent populations. Okay, now let's look at some of the trends. What's been happening to the epidemic of tobacco in Bangladesh, in Pakistan, in India? If you look at the smoking prevalence over the last 20 years, by the way, this stretches more than 20 years, in fact, it's 30 years. So if you look at what's been happening of the prevalence of smoking, which is this purple bar here, so if you follow the purple bar, I think whether you look at females or males, you can see a consistent downward trend. That's good news. That means that the smoking prevalence in males in Bangladesh, in Pakistan, in India is seeing a downward trend. Okay. And a good thing is that smoking prevalence was never that high in Bangladesh, India, and Pakistan anyway, but it's also seeing a downward trend. So that's a good sign that smoking is on the way out. And we hope that over the next 15, 20 years, we will see very few people smoking, and it will become an outcast. That's not just a hope, that is the trends that I'm showing here. So that's good. We can expedite it, of course. But if you look at smokeless tobacco, unfortunately, the trend is flatlining mostly. And just look at Pakistan, for example, among males, you can see that smokeless tobacco use has not gone down. It has flatlining. And we know, as those belonging to medical profession, that when things are flatlining, they are not a good sign. So that means that very little progress has been made to reduce the smokeless tobacco prevalence or chewing tobacco prevalence. And that is something that we need to address now, while we're seeing a downward trend in smoking. Otherwise, what will happen over the next 10, 15 years, that we will few people smoking, but still a lot of people using smokeless tobacco. And sadly, it can also go up, because as people will stop smoking, they may substitute their smoking with smokeless tobacco. So where do you start? You have to start in adolescence, in youth. As you know, that most of people who are starting tobacco use, they start as young people. So we have, luckily, a lot of data from these three countries from Global Youth Tobacco Survey. And we can see already this trend of smokeless tobacco predominant, being the predominant form of tobacco use in young people. And in this case, even in Pakistan, where we know that the adult smoking is more than smokeless tobacco, but that is not the case in young people. So this is from a survey of 13 to 15-year-olds, a national survey, which looks at cigarette use and tobacco use. And you can see that smoking trend is there, but smokeless tobacco use is even higher in young people. Yeah. So what are the pro-tobacco factors? In fact, we talk a lot about youth taking up tobacco, but youth is only imitating what adults do. If they see tobacco use in public places, if they see tobacco use in media by our celebrities, if they're offered free tobacco products, then they're more likely to take up tobacco. So it's not a youth problem, it's actually our problem. We are corrupting our youth by exposing them to tobacco, either by offering them free tobacco products or asking them to go and buy it for us, or exposing them by actually being not very good role models by using tobacco in front of them. And then obviously celebrities and people who are famous, politicians and so on, they are not being a good role model if they are showing that image. So what are the anti-tobacco factors? And from our research, we have shown that the biggest factor that stops people or young people from taking up tobacco is if shopkeepers refuse to sell tobacco products to youth. And that is very, very important, because if you look at a number of shops, particularly in rural areas in Pakistan, young people have access to smokeless tobacco products, and not as much to cigarettes, but pretty much to smokeless tobacco products. And that's why it's still very common, because they have access to it. And shopkeepers do not refuse to sell tobacco products. If they do, then this would be a problem solved. There's also little influence of anti-tobacco campaigns. So I think we can have many, many campaigns, but as we haven't seen much evidence that these campaigns work on young people. In fact, the more you tell young people not to do something, the more they're likely to do it. So it is important that we have some strong policies, not just campaigning. So what are those policies? Strict enforcement of bans on advertising smokeless tobacco, promoting it and sponsoring it. And that includes electronic and social media. And we should really help to stop sale to and by minors, young people, which is likely to be very, very impactful. I'm going to talk a little bit about tobacco taxation. And I know that most of the audience here are not economists, so just bear with me as I explain what I mean by that. So there is a lot of evidence from smoking, and also gradually evidence is developing in smokeless tobacco, that when you raise taxes on tobacco, as a result, the price of tobacco goes up, because the tobacco industry pass on the increase in taxes onto the consumers. So when the price will go up, what will happen? It will reduce the use of tobacco, particularly amongst people who are finding it difficult to afford it, young people, and we measure that as price elasticity. So for every 1 unit increase in tobacco taxation in India, there could be 0.5 reduction in tobacco use in smokeless tobacco in India. And actually very similar figures from Pakistan and very similar figures from Bangladesh studies. So it's all been confirmed that if you're going to raise taxes on tobacco, you're going to see a reduction of smokeless tobacco use. And it is definitely there in cigarettes, and it's definitely there in smokeless tobacco. But unfortunately, and this is really a sad situation, that Pakistan up till now has not implemented any taxes on smokeless tobacco, while there's taxes on cigarettes, and we like to see higher taxes on cigarettes, because it's still cigarettes are one of the cheapest cigarettes in the world are sold in Pakistan. But when it comes to smokeless tobacco, there's absolutely no tax on smokeless tobacco. And I think there are some examples from India and Bangladesh where there are taxes. So it's not impossible to put on taxes on smokeless tobacco. As you will see from India, they have a number of different taxes on smokeless tobacco, and also Bangladesh. There's one thing to remember, that WHO wants at least 70% taxes on tobacco of the retail price. So for example, if you're selling a cigarette pack of 100 rupees, 70 rupees should be tax. So if you increase taxes, then obviously that will push the price up. But even in India and Bangladesh, where taxes are implemented, it is not 60%, 70% of the retail price. In India, 60%, and in Bangladesh, it's 100%, but on ex-factory price. Ex-factory price is not the same as retail price. So on retail price, when it translates into retail price, it's actually less, much less than that. But the other thing we have to watch for is that as economies grow in these countries, generally things become more affordable. So even if you increase taxes, and if you increase taxes to a smaller scale, smokeless tobacco is going to be more and more affordable, and it has become more affordable in India and Bangladesh. Therefore, tax increase on smokeless tobacco needs to be frequent and high. And I would argue that greater than increase on cigarettes. And the reason I say that is because we've already got taxes on cigarettes, but actually there's a long way to go in terms of smokeless tobacco. So whatever incremental tax should go on smokeless tobacco should be incrementally higher than cigarettes. And we also need a minimum floor price. So this is the minimum floor price, that it's not just the taxes, but also we need to fix a minimum price. And it should be as high as a pack of 20 cigarettes. So if cigarette packs is sold for 60, 70 rupees, that is what should be the minimum price of buying a smokeless tobacco product. Let's look at the products themselves. I think we need to just remind ourselves that there is a big difference between the products, smokeless tobacco products, and smoking products. When you buy a cigarette, no matter which part of the world it is, you know exactly how much it would weigh, what it would contain, how much nicotine it would have, how much cancer-producing substances such as nitrosamines it contains. But when you buy smokeless tobacco, even for the same volume and same quantity, you're going to have a difference in nicotine, a difference in nitrosamines. And when you're selling them, or you see them being sold, they're sold in variable quantities and variable size packs. Why that is a problem? The more diversity you have in the composition of tobacco products and also in their packaging and labeling, you're going to find it very difficult to regulate it. Therefore, standardizing the composition of tobacco products, standardizing the packaging and labeling of tobacco products is paramount to its regulations. We've already seen that smokeless tobacco products are sold and by children in many parts of Pakistan, in many interviews and focus group research that we've conducted over the years. And not only that, but there's also point of sale advertisement of smokeless tobacco in South Asia in general, but in Pakistan in particular. So we have very little regulation, in fact, hardly any laws to control smokeless tobacco, regulate smokeless tobacco in Pakistan. In this figure, if we focus on these bar charts where there's a comparison between Bangladesh, India, and Pakistan, you can see that most products have no text health warnings, no product had pictorial health warning, and many products have got misleading descriptors on their products packaging. So this is quite a sad situation, and I think we know that if we have laws, then you can see the effect, because in Bangladesh and India, things are not perfect, but still most products contain text and pictorial health warnings. And why this is important? Because we know that if there is a text and pictorial health warning on tobacco products, that is going to put young people off buying it. So how do we regulate these products? We need comprehensive regulation and strict enforcement. We need to set standards and product surveillance, and we should have a network of labs which can test these products. As I say, we need to standardize and formalize these products, and it is important that to formalize it, otherwise it would be very hard for us to regulate them. We also need to consider viable alternatives, because we have done this research recently that smokeless tobacco sellers and distributors are willing to switch to viable alternatives. And this is where authorities need to offer them alternatives with due profitability, and they would consider it. Another important aspect is to empower communities to take action against selling smokeless tobacco to children. We are not going to have a police officer in every village in Pakistan patrolling and monitoring the sale of smokeless tobacco to young people. It is also down to communities to monitor this and to make sure that these products are not sold to the children, not advertised at the point of sale. Finally, I would like to just briefly touch on smokeless tobacco cessation. These products are very, very addictive. And if you compare them with cigarettes, the smokeless tobacco products contain high levels of cotinine, which is a byproduct of nicotine, which means that they are almost 3 times as more addictive than cigarettes. So therefore, we need strong innovation, strong medications, counseling, combination of nicotine replacement therapy to help people to quit. They're not just going to quit by simple advice or simple campaigns. Unfortunately, there is not many studies done. You can see that hardly any randomized control trials are conducted in our part of the world, and therefore the evidence is not there. And we need more studies, more evidence to do such that. In fact, we are conducting at the moment a multi-country randomized control trial of nicotine replacement therapy in Pakistan. And although the results are still being analyzed, but we're seeing some encouraging signs. I'll finish off with this concluding slide, which highlights the 6 points that I would like to make in relation to smokeless tobacco, and that would summarize my talk as well. Talking of products, smokeless tobacco products need to be regulated. We need to remove flavors, restrict the level of nitrosamines, which causes cancer, set standards, and constantly monitor their contents. When it comes to sellers, we need to issue retail licensing and also offer viable alternatives. In terms of marketing, we need to strictly ban marketing and advertising both in the shops and also in online or social media. We need to consider standardized packaging for smokeless tobacco as well as cigarettes. When it comes to children, we need to empower communities to enforce bans and legal age, and we should expand cessation services and help people to quit smokeless tobacco. And last but not least, we need to increase taxes frequently more than cigarettes with a minimum floor pricing. With that, I thank you very much for listening. I hope you enjoy the rest of the conference, and I wish you all the best. Thanks a lot.
Thank you very much, Professor Kamran. He has raised some really essential points about smokeless tobacco. The fact that the youth are particularly sensitive to this, and they are also sensitive to the price of smokeless tobacco products. So whilst we're making some headway on cigarette smoking, there's still a long way to go in improving the control policies around smokeless tobacco and addressing the cultural aspects of this particular thing. Now, because of some technical issues, when we move on to our next guest, it will be Shariq Khan, who we'll introduce. Shariq is actually not... Yeah, we're just confirming that we can go live to Shariq Khan. Yeah, so that's brilliant. He is not a medic, not a researcher, and not a lawyer or an economist, but a very concerned citizen and a creative media director and producer, and importantly has used these skills that he has to really bring forward and emphasize the importance of tobacco control through social media platforms. I really appreciate him being with us today, because we have so much to learn from what he has achieved so far. He's been a little bit unwell in the last week or so I really appreciate the time that he'll give us today. And let's have a listen to his advice on how to address policymakers and legislators for tobacco control policy reform through social media platforms. Thank you, Shariq, and I'll let you carry on.
Thank you, Dr. Saima and Dr. Zia, for giving me this opportunity. I have uploaded the presentation if somebody can play it from your end.
Shariq, are you able to just play your slides now?
If not, actually, let me just do it again. Give me 1 second. Till it's being uploaded, let me just talk about what we basically are and what kind of an organization we are. So basically, I represent an organization by the name of Chromatic. Chromatic is an organization that uh, basically is a byproduct of a media production house that used to work for the entertainment industry here in Pakistan and internationally as well. But few years ago, we decided to utilize our strengths and our connections for the betterment of quite a few things. So tobacco is one of those issues that we feel quite passionately about. Basically, what we've done over the years is we've cultivated, this large network of people through our social media. So it's uploaded, Dr. Saima. Presentation is uploaded. Okay. So can you see it? Should I start? Okay.
Yeah,
So
we're ready.
using social media. All right. So basically, my topic is quite simple. How do we use social media to address policymakers for tobacco taxation reforms in Pakistan, right? So, like I said, Chromatic is basically a creative agency that handles social media in its true form. So, 360 degrees handling social media monitoring and influencer engagement, and then the content that needs to be generated to get the right message across. Pakistan saw a massive surge in the internet users in 2021, where it went up from 40 million to 61 million. Then the internet users were increased by 11 million between 20 and 2021. So that was a huge jump that we saw because of COVID. Absolutely, that was the most important reason behind it as well. Internet penetration in Pakistan stood at 27.5%, which is a huge number, because we are amongst the top 10 internet consuming countries in the world. Social media users, increased exponentially as well by 2.4 million, taking the number up to 37 million users in Pakistan. And this is something that we need to understand, that this is a daily number, not like a yearly number. This is a daily number that we're talking about. So social media penetration is now at all time high, 17%. So we decided that, when we saw that Pakistan has seen quite a lot of things happen because of this power of social media. We got the elections. Imran Khan was elected, and he is basically he is brought into the power and into the office because of the right use of social media. Now you can see all official announcements are through social media. They're not done through the traditional media. And everybody's talking about how fifth generation warfare or information is being led through social media. All the traditional media is now placed on social media. So it was also a leading news generator as well. So we thought of a plan that, we need to use it and utilize it for our betterment, for our country's betterment as well. So we started a campaign by the name of Pledge Against Consumption of Tobacco on social media platforms, with obviously partnerships with Bloomberg and all you guys as well. So basically, what did Pact do? Pact was basically a digital advocacy campaign aimed at generating discourse for influencing policy regarding tobacco usage. So we wanted to have presence on Facebook, Twitter, and Instagram, and we wanted to do it in a way that we use influencers, journalists, parliamentarians to affect and to generate that kind of noise that would push towards the policy change. These are the platforms. If you do get time, do follow us on these platforms. We're available everywhere. So target audience was very simple. So when we were selecting it, we kept it really simple. So for youth, we wanted to target Instagram. For adults who contribute in passive smoking or are contributing towards non-smokers, we wanted to target them through Facebook, and parliamentarians and policymakers obviously through Twitter. Our objectives were very simple. We wanted to garner support from policymakers, opinion leaders, and general public on plain packaging, and we wanted to encourage sensitize target segments to consider policy on tobacco taxation. We wanted to couple up our social media run with on ground activities as well. So we got in touch with religious affair ministry, Maulvis and scholars, and all these people became a part of the campaign. We started recognizing them on our social media platform, and we started honoring them as well. So we went to doctors. We have an association of doctors who constantly talk about the same problem and menace that we face due to tobacco. Then we went to universities, engaged with students. We wanted to generate noise where we can have the voice from the youth to talk about it. We've had walks. We are heavily engaged with the entertainment industry, journalists, and the civil society as well. So we felt that to make something happen on social media, we need to have ground power as well. So we did quite a lot of engagements. The results were beautiful. When we started trending on Twitter, we started getting results like 6.3 million, reach, 7.5 million reach, 3.7 million reach, and these were all organic trends. We did not have to spend money. We were getting support from the masses, and the policymakers started to associate themselves with our campaign as well. And it became like a really beautiful movement, to say, because what we were seeing was that people had stories to tell, and they were telling through our platforms and our hashtags. So it became a journey that we still are utilizing for the betterment. Then the impact, we saw that the awareness, the awareness went from right here to there, and the people started getting more informed. They started engaging with our content. People started offering us to have joint efforts to make improved networks. We had multiple amplified voices and noise projection spots. Then uh, when we started, we had a stronger collective working to address the menace. Initiatives were starting from places that we did not had even reached out to. So for example, somewhere in Sindh, we would get an email saying that because of your campaign, we are doing this in our community. Because of your documentary or your music video or your content, we are doing a certain something. And because of that, we've seen a lot of results. So even I would like to give an example over here. Junaid Akram is a big social media influencer. He became a part of our social media campaign back in 2019. He was a smoker back then, And right after he became a part of our campaign, he left smoking. And this 27 years of habit that he had, he let go of it because of the pressure that he got from the social media as well. And now he's a contributor, and he's helping us out as well. Then the tobacco industry plays very nasty role in basically disarming our campaign. They've come up with a campaign to counter our campaign by the name of Behtar Pakistan. Behtar Pakistan was a campaign where they had engaged with policymakers, celebrities, and they paid them millions of rupees, millions and millions of rupees. It was led by many big policymakers and artists, and they were getting paid. But the worst part was, Behtar Pakistan was misleading these celebrities. They were lying to the celebrities. They were saying that the campaign that we are running is for illicit trade, which is funny because we pact basically talks about putting taxes on any kind of brand, anything that is related to tobacco. We want it banned in Pakistan. And so it was a funny twist that they wanted to give. But we saw that people started engaging with these celebrities on them, on their own. And we started seeing that these guys started deleting their tweets and their content. So we had like really big names like Wasim Badami and Farah Sadia and all these people, Ikrarul Hassan and all these people. When they saw that they were getting a lot of hate from the general public, we had informed earlier that Better Pakistan is a malign campaign. So they started deleting these things. We saw that a lot of very, very famous TV channels and TV programs started to pick up our topic. They started contacting us, and they started asking for research and asking for why are we doing this and how they can contribute. So shows like Aftab Iqbal Saab show also did an entire show on it. Then we saw that senators like Nuzhat Sadiq Sahiba, she started asking questions from the government. And she would tweet to us. She would ask us why aren't the taxes being increased in Pakistan. And we would tell her what is going on, how things are being played. And this was done all through social media. We were engaging with these people all through social media. And when she got in contact with her, we gave her the research. She asked the question, and the results that we got were just amazing. People like Mubashir Lukman and all started showing prices of cigarettes, and and how tobacco has not taken a hit as far as taxes are concerned since the past 3 years. I think now we have generated enough noise that we're at a tipping point. The government will have to put taxes on tobacco. And we feel that our campaign, especially the recent campaign that we've launched um, after the mini budget, where we've spoken about how you know you can tax milk, you can tax food for children, but you cannot tax cigarettes. What kind of hypocrisy is that? So now we feel that our campaign has taken a different turn. And we've seen quite a few heads move around now, and they are talking about it. And hopefully we will see good results very soon. Thank you, Dr. Saima.
Thank you very much, Shariq. And that was a really insightful walk through the methods that you've used through social media and the huge impact that it's obviously having. And inshallah, in the next few months, the impact will grow. So I'll hand over to Dr. Zia, who is going to introduce our next speaker to complement this particular talk.
Yeah, thank you, Dr. Saima. I must thank Shariq to expose the tobacco industry's deceptive marketing and influence on in the government of Pakistan and the social media in Pakistan to divert the attention of hazards of tobacco use in the country and giving wrong messages. Now, we all understand that tobacco is a serious issue and killing millions of people around the world. And unfortunately, Pakistan is facing around 450 deaths per day due to tobacco related diseases. Definitely, we need to have a strong tobacco control policy for countering this tobacco epidemic in Pakistan also. I would like to invite Malik Imran, who is a country head of campaign for tobacco-free kids in Pakistan. Other than this, he's basically a lawyer, but he's a development consultant in Pakistan. Mr. Malik Imran, please continue forward.
Thank you very much, Dr. Zia, and thank you very much, Dr. Saima. Do you hear my voice?
Yes, we can.
Okay. And the slides, can you see that? Can everybody see the slides?
Yes, slides are.
Okay. So thank you very much. I think the topic is very important, and although this academic whole program is mostly on the health side of the tobacco issue, but I would stress again, as explained by Dr. Kamran and Shariq before me, that there are many other angles in which this tobacco has affected us. And I'm going to explain in how many ways, in how many other ways that this tobacco use is impacting us. And there are more than health issues to it. There are economic issues, there are social issues that are associated with the use of tobacco in Pakistan. And that is why we need sustainable tobacco control policy in Pakistan. So, as everybody know, these are some of the figures that have been established through various studies. And we know that the use of tobacco among children is alarmingly high, which is 10% of all the users in Pakistan. And these are the children which are between the age of 13 and 15. And this figures we have taken is from the GATS, which was, some 5 to 6 years ago. And we do not know the current figures, but hopefully we will have them as soon as WHO do the recent GATS and JITS survey. And we know that 83 billion cigarettes are produced in Pakistan, which generate a large revenue, not only for the government, but a huge profit margin for the industry, who then use these profits to manipulate the systems in Pakistan. In order to understand holistically how tobacco impacts our country, we have to see their effects on youth, our health, the poverty that it generates, and the economy, overall macro and micro, both economies in Pakistan. We know that tobacco industry is destroying our future. And that is because, as we all know, that 170,000 plus people die every year in Pakistan. But the sale of tobacco never comes down, although there are a lot of people that are dying because of it. That is because the tobacco industry considers our children as the replacement customers. They target them because they know that they need additional customers to continue their sale. And that is why they target children well below the age of 13, so that they become their regular customers for the rest of their natural life. And this is very alarming because We had this tiny target survey which showed their approach, and this survey was conducted not only in Pakistan but in India and Sri Lanka and Bangladesh as well, and it showed that 99.5% of the tobacco point of sales had single stick sales, although it is banned in Pakistan. But we still see that in remote areas there is still single sticks being sold out, and they are specifically for the kids who do not want to buy or do not afford the whole cigarette packet to buy, and they want to hide it from their parents, and they cannot take the whole packet back to home, and they just want to consume it. We also see through same tiny target survey that there are lot of incentives given to the shopkeepers and kiosks to sell these tobacco products to the children by putting them and displaying those cigarettes with the candies, with the toys, and at a height where kids can easily see them, and within the point of sale advertisements as well. So we can securely say that tobacco industry is deliberately targeting our children to become smokers. And we know through a study by WHO that 1,200 children below the age of 15 become smokers every day. And this figure may rise and may have already risen because of the population growth, because of the tactics that the tobacco industry is using, and this will definitely increase the consumption in our country in future, destroying our future generation. We also know that these tobacco industries catch our youth by different programs like Battle of Minds, in which they allure the youth by telling them that we are going to give you some jobs and something incentives and things like that if they join their program, and by those youths they propagate their products and advertise it indirectly to the other young people by creating such youth champions, so-called champions for their cause, for selling these deadly products to the children. And that is why we need, as explained by Dr. Kamran, that we need tobacco advertisement promotion laws to be more strict, and especially as the new age is the internet and social media age, we need to have those laws which can cover these areas to stop tobacco industry manipulating them for advertising and promoting their deadly products to the young people. We also see that when the Ministry of Health increased the size of health warning on a cigarette pack from 40 to 70%, the tobacco industry, put all their efforts to stop that. So much so that at that time, the Minister for Finance was deputed to the Minister to Health to stop her from increasing that size. They put an expensive lawyer in the High Court to make sure that this new order is not implemented at all. Why they do it? Because the chronic smokers do not care what size of picture is there and what picture is at all is there on the cigarette pack, but the young ones who are not smokers, who are going to smoke for the first time, they always are impacted by the size of the picture and how bad it looks. They always are influenced by that picture. And unfortunately, we see that among the region where there is Nepal, India, Sri Lanka, all have 80 or above graphical health warning size. Pakistan is way below the regional players, only at 60% currently. We are fighting for it to increase it, but definitely it will take time. As everybody knows, because you are all health experts, you know that tobacco destroys our health, and 170,000 plus people die every year. 5,000 people are admitted to hospitals because of tobacco alone. So this is a very huge number that the government never considers. while making a tobacco control policy or increasing the taxes. So far, in Pakistan, we don't see there is any policy at all. And we see that the taxes are increased on a knee-jerk base. There is no proper way to do these things. We also know that tobacco industry increases poverty and malnutrition among the young, the children. How it does it? Because tobacco, um, you know, takes out most of the income from the low middle income household. They spend on it not only directly by buying the products, but also indirectly by spending the cost of health when they become sick because of tobacco. While this essential money can be used for basic food, health, education, housing, and other stuffs which are important to increase the lifestyle of that household. But when it is spent on the tobacco or tobacco related diseases, that household become more poorer. So this is a vicious circle that tobacco has always created among our population, which belongs from mostly from the low middle income group. As has been said, 25.3% of the households in the lower income group smoke cigarettes, and 10% of their average monthly income goes on that. This is a direct cost. So I'm not talking about the indirect cost, which is spent on the health, which I will talk about later as a macro level. But this is 10% of their income means if they are earning 20,000, that means 2,000 rupees is spent monthly on cigarettes, which is a valuable money, which can increase the lifestyle of themselves and their family. At a macro level, tobacco industry destroys our economy. And as said, we only generate some 110 plus billion rupees from the federal excise duty that is imposed on the sale of cigarettes alone. And it only comprise 1% of the total workforce in the tobacco sector. It's a total workforce which includes industry as well as farming. So if we remove farming, the level of employment is way below 0.1%. So it doesn't really play a very important role in our economy. But if you see the health cost that it puts on our meager resources, it's 650 billion rupees. This is a PIDE report, which is a semi-government institution, and the results are very, very shocking for us as well, because this is about 0.3% of our GDP, and it's a huge loss as compared to the revenue that we receive from the sale of cigarettes. So tobacco industry, what it does to counter this argument is that they say whenever you increase the tax, there is going to be an increase in illicit trade, and tobacco industry spends millions, not billions of rupees to show to the government through different means, as has been explained by Shariq Khan, that they spend a lot of money in inciting these celebrities and paying them off to say that there is a huge illicit trade in Pakistan and the government need to stop it. This is because they want to show the government that because of the rise in taxes, there is a huge illicit trade. Otherwise, we all know there have been different research, independent research, which shows that the illicit trade is between 10% to 60% of the total sale market. Although they say that there has been a huge illicit trade, but we see that the profits of the tobacco companies are always increasing. They never come down. And our government institutions, they do not bother to look into their profit graphs to make sure that whatever tobacco industry is saying is false. But they digest it and they agree to the tobacco industry. We fail to understand why the government institutions are doing it, and we see that they are doing it deliberately, not to increase the taxes, because they are afraid that there will be an increase in illicit trade, but they don't see that the profits are continuously increasing year by year. Back in 2017, we saw that when the taxes were reduced to half, almost half, by the government through introduction of the third tier in the tobacco tax structure, we see that the production of cigarettes jumped almost 90% in that period during the first quarter after the tax was reduced. And we know that when the production jumped, that means the consumption also jumped, because the shelf life of tobacco cigarettes is very small. World Bank says that if you want to reduce cigarette consumption in the country and you want to have a growth in the tobacco revenue, you have to increase cigarettes by 30%, sorry, cigarette taxes by 30% annually. And that World Bank report was released back in 2019 after they surveyed all the research articles in the country, including articles which were generated by the partners of CTFK in Pakistan. So we came to the conclusion that the overall impact of tobacco industry in Pakistan's economy is negative. It costs us 650 billion every year. It kills 170,000 people in Pakistan every year, and give them a disease to lot many others. It increases anxiety, stress, poverty, malnutrition, and damages our environment. Tobacco is never a commodity for us for any reason. And there is no plus point for having tobacco in our country. And that is why we need a very comprehensive policy to make sure that in coming next to 15 to 20 years, we have to reduce the consumptions down to zero to make sure our future generation is safe from this deadly product. If we reduce the tobacco, there are humongous positive impact. A recent study has shown that if we increase the tax share of the retail price is increased to 70%, we would reduce the consumption by 32% every year. So it can continue up to, bringing it down to zero. And we can increase the revenues by 102%. Currently, we are generating around 125 billion, and it can go up to 255 billion. And it also shows that the impact on illicit trade is almost negligible if we increase the taxes. And the health cost burden would be reduced to 50%, which is currently at 650 billion. It will come down to around 300 billion. So we see that there is a very positive impact if we start reducing tobacco consumption in Pakistan. And for that purpose, we need a very comprehensive tobacco control policy framework. So far, we have not seen one, although the Ministry of Health says that they are working on it. And through CTFK's technical assistant, they have developed one format of tobacco control policy in Pakistan, but that is still under consideration. Pakistan should act now and adopt a policy that ensures there is a reduction in consumption, there is improvement in public health, and it guarantees child health, education, and nutrition. And one of the proposals to fund these activities was to impose health levy or tobacco surcharge on the tobacco products, not only on tobacco products, but also on the sugary products, which are dangerous for the health of the people, and to use those funds to the betterment of the public health at large. At the end, I would again say that 1,200 Pakistani children between the age of 6 and 12 start smoking because of the direct targeting by the tobacco industry, and we need to stop it. Thank you very much. Thank you, Dr. Saima and Dr. Ziauddin.
Thank you very much, Malik Saab, for your insightful discussion and useful background to why taxation is a way forward. I think that unpacks a lot of discussion points which we can talk about later on. I'll let Dr. Zia now introduce our final speaker this afternoon.
Thank you, Dr. Saima. Indeed, raising taxes on tobacco is one of the most effective ways to reduce tobacco use. Tobacco excise taxes are the powerful tool for improving health, while at the same time being a reliable source of the government government revenue. Article 6 of WHO FCTCs itself recommends to government to increase the taxes. And for last many years, those working for the tobacco control in Pakistan are recommending government of Pakistan to increase tobacco taxes, which are unfortunately there wasn't any improvement for last 3 years. These recommendations are based on the technical testimony, best practices, and understanding the countries that have efficiently implemented tobacco control policies in a way that have improved their people health. For example, Australia, Canada, UK, even in our AMRO region, Saudi Arabia has a significant amount of tobacco taxes. For discussing on tobacco taxes, I would like to invite Dr. Mohammed Sabir, who is the principal economist at the Social Policy and Development Center. He was a member of advisory panel of economists and working group in the macroeconomic framework and development strategies with the government of Pakistan. Dr. Sabir has a research focus on social implication of tobacco taxation policies and has had several publications in this regard. So I request Dr. Sabir to speak on economic implication of cigarette taxation in Pakistan. Dr. Sabir, please.
Today, I'm sharing about the finding of my study, which is based on a CG model for Pakistan, and the study's title is Economic Implication of Cigarette Taxation in Pakistan. My name is Mohammed Sabir. I'm a principal economist at Social Policy and Development Center, and this research is funded by the University of Illinois in collaboration with University of Illinois, Chicago. What is the research motivation behind this analysis? Basically, the inclusion of framework of Convention of Tobacco Control of the World Health Organization in the Sustainable Development Goal recognize the prevalence of tobacco use is a critical development challenge. However, in Pakistan, if you look at the statistics, you find a higher prevalence of tobacco use, low level of tobacco taxes, complex FD structure, favoring low price brands, and lack of evidence allow industry to manipulate tax policy. So that's why so far industry is successful in manipulating the tax policy, and they are not allowing FBR to raise taxes to 70%, which is well accepted level of taxes, minimum taxes for the retail of tobacco taxes. So the study is to generate some evidence. Okay, what will happen if we increase the federal excise duty, which is recognized as a tobacco tax, to the 70% of the retail price on the tax revenue, on the cigarette industry, and on the overall economy. So, and the research objective is to investigate the impact of higher tobacco taxes on cigarette consumption and tax revenue from cigarette, to assess the impact of decline in cigarette consumption on tobacco-related agriculture industrial sector, along with its impacts on macroeconomic structure of the economy, and to analyze the distributional impact of changes in the tax rate and cigarette consumption on the household tobacco growers and the employees of cigarette manufacturers. So our research strategy is to use CGA model. And why we preferred CGA model? Because the CGA model is to simulate the impact of higher tobacco. Because there are three advantages of using CGA model. CGA model are based on the well-developed economic theories and are firmly founded in macroeconomic theory. This allows for analysis of macro linkages with the important distribution and welfare analysis. CGA model are the extension of input-output multiplier model and the social accounting metrics, which have been widely used for decades to measure the effect of public policies and also to simulate the impact of public policy choices. The CG model considers the production linkages, economic flows, and their interaction in a flexible and theoretical consistent fashion. So these are the basis for which we are using CG model. But before we go into our model and simulation analysis, we just want to give you an idea of what is the role of cigarette industry in the macroeconomy. And there is a lot of talk about the cigarette industry that they are contributing the macroeconomy. It is one of the largest scale manufacturing industry in the Pakistan. And they are paying heavy taxes. And one of the former finance ministers said, if we raise the taxes on the cigarette industry, it's likely to reduce revenues, and maybe we are not able to finance the income support program. So this is one of the statements of the former finance minister. That's why we are looking into the nuts and bolts. Okay, where the cigarette industry industry stand in the macroeconomy of Pakistan. So tobacco as a raw product, marginally contributing 0.03% in 2019 to 2019-20. And it is even lesser than 0.1% of the GDP. So the tobacco growers, as a raw tobacco, is not contributing a lot in the GDP. Cigarette industry is contributing from 0.39% to 0.3%. And all adding together, they are not contributing in even the half percentage point of the GDP. Second argument is that Pakistan is one of the 10th largest producer of tobacco. So one of the arguments maybe the industry has the export potential, and they are also generating or attracting a lot of foreign revenues, foreign exchange. But our analysis shows that this is also not true for Pakistan. So raw tobacco we are exporting, it was in 2015-16 hardly 1 billion. And now in 2019-20, after getting some momentum, it reached to 2.6 billion rupees. And mind it, it's not dollars, it's 2.6 billion rupees. But this is the case of raw tobacco. But if you look the cigarette export of cigarette, the contribution is even lesser. So the number shows 154 million rupees in 2015-16, and gradually it increased after having some yo-yo, we're having in the peak 2017-18 of 344 million. In 2019-20, it reached to 224 million rupees. So it's not a big amount which cigarette industry is attracting in Pakistan. Share of export value in raw tobacco and cigarette in relative term, if you look. So after let's assume that the export of tobacco is 100%. So out of 100%, only 12.4% exported in 2015-16. And the highest export of raw tobacco was in 2018-19, which is almost 26%. But in 2019-20, it's also declined to 17.4%. So out of 100, only 17.4% of raw tobacco exported. And the cigarette industry's export is even meager. If you look the number, it's 0.08 in 2015-16. It's marginally increased in 0.32 in 2017-18. And finally, further, it's declined to 0.09%, which is again less than the 1 percentage point. So cigarette industry is not contributing a lot in the macroeconomy, and cigarette industry is not contributing a lot in terms of fetching foreign exchange to the Pakistan. As we said, the structure of excise duty is complex, and there are a lot of reforms took place in the cigarette industry in FED. So I'm just giving you a glimpse as to what had happened in the past. In 2013-14, there are two-tier structure in Pakistan, and the lower tier is having the tax of 880 rupees on 1,000 cigarette. And the upper tier is 2.3 thousand on 1,000 cigarette. So that was his structure, which gradually having different phases, it reached to 3-tier, converted into 3-tier, and the third tier has a very less amount of tax, which is only 800 rupees. And there's a lot of criticism from the tobacco advocates, and there's a lot of criticism from the academia. Finally, this third tier removed in 2019-20. And as you can see, from 2019-20, there was no change in excise duty. So the budget 2020-21 was silent on the changes in the tobacco taxes, and the 21-22 budget, which was presented in July 2021, did also not change any tax rate on the federal excise duty on tobacco. So the tax rate didn't change since July 2019. What is the impact of not changing the taxes? So if you look here, the effective tax rate, how much per cigarette tax in Pakistan, and that is the weighted average. So it's 1.69 in 2015-16. Then it went up to 1.93, and then gradually or suddenly reduced to 1.14. And this is the year in which three-tier structure introduces in Pakistan, and the lower tier have a very low tax. So after that, marginally increased to 1.48, and then afterward it's 1.94 rupee per stick tax till 2020-21. And the recent statistics show a marginal improvement in it, but that might be the contribution of higher changing share of higher tobacco or lower tobacco, and reducing the share of lower tobacco, because the taxes is not changed and the price is also not changed. So there is a literally, and then everybody is talking about there's a lot of inflation, but in cigarettes, there's no inflation at all. So the recent statistics even shows that there is a zero inflation. And that is why cigarette in Pakistan is really cheap. So if you look the number, and this is the comparison of the regional countries, so Pakistan stands lowest, among the lowest, and it's only $1.6 price of a pack of cigarettes. So which is definitely very cheap compared to what in Sri Lanka, India, Maldives, Nepal, Iran, and Bangladesh. The only country which have even lesser prices than Afghanistan. Because the cigarettes are cheap, they encourage smokers to the country. Again, how much the cigarette industry is contributing in the taxes? So if you look the number, there are two types of taxes. One on the domestic production, the other is domestic consumption and production, and the other is on tax on imports. So in domestic production, the numbers show some yo-yo. In 2015-16, it was more than 19 billion, which cigarette FPR collected from the cigarette industry. But in 2016-17, cigarette industry used their manipulation power and reduces the declared production. And it's not actual production which is reduces in Pakistan. It was the declared production which is reduces Pakistan, and that's why the taxes declined sharply from 90 billion to just 66.3 billion. In 2017-18, its margin increased to 67 billion. But after introducing of the third tier, the tax increases to 90.16 billion. But afterward, FPR change the tax rate, its margin declined to 88.6 billion. The recent number shows that this number gone up to 107 billion. Sales tax on domestic cigarettes is almost flattened. It's around 20 billion or marginally 20 billion. So the total contribution of both taxes is 111 billion or 112 billion in 2019-20. The collection from the imports is very low. Only in 2018-19 is 2 billion. Otherwise, it's less than the 1 billion. We started our analysis by mapping the 81 sector of input-output metrics into 13 sectors. And we prefer the following 3 sectors based on the household survey. So these sectors are food sector, which include most of the food category, as you can see. The other sector is tobacco, which is raw and manufacturing cigarette, because this is the main idea of this analysis, to see the impact on tobacco sector. And again, then we have a third sector, clothing. After that, we are health. We are looking health and education, transportation, energy, public administration, housing, household commodities, recreation, and other sector. So without going much into the details of these sectors, I'm moving towards the social accounting metric, which is the next step. And these results are categorization also available in our reports. We give the shock of now this slide explains how we give this shock and what is the magnitude of the shock. So in the base case scenario, which is the present existing scenario, the net of tax prices is 1.25 per cigarette. Effective FED is 1.48 and GST is 0.46. So total price included of taxes is 3.19 in our base case scenario. In order to make this 3.1, this 1.48, 70% of the retail price, we give the shock of 285%. So our effective excise duty FED rate increased from 1.85 to 5.7. And then consequently, because GST is a percentage, 17% of the price of net of taxes and FED, this is also increases because increase of FED, so it's increased to 1.18, and total price inclusive of taxes increased to 8.13. So what is the magnitude of shock? 285% FED shock, 156.5% GST shock, and 154.9% price in total price shock on prices. So the final consumption prices will increase by more than 159%, more than double. Massively. In this case, there is 84,000 sticks, and then it's declined to 57. And the reduction of shock is more than 32%. Now the catch is when you raise that taxes on cigarette, there's likely chances demand for licit cigarette will decline, but demand for illicit cigarette may increase. But our analysis shows that when you give us such a huge shock, then the demand or the prices of illicit cigarette also or undocumented cigarette also gone up. And that's why there's a decline of illicit cigarette as well. So what we found, interestingly, through our analysis, if you give this kind of huge shock, there's a more than 42% decline in the consumption of legal or licit cigarette, and 5% decline in the illicit cigarette, and total consumption of cigarette likely to decline by 5.34%. Again, what would be the impact on the tax revenue? Because we are giving very high shock of more than 200%. So the tax revenue would be double as the light of our simulation, where it will likely to go from 118 to 239 billion. And FED revenue are the main contributor because it's gone up from 90 to 198 billion, and the GST revenue increased from 28 billion to 41 billion. Tax on other sectors didn't change much, and overall indirect taxes collection increased by 6%. What will happen on the household consumption other than cigarette? Sorry, this is the million stick and this is million rupees. So in million rupees, household consumption expenditure will increase. Legitimate cigarette consumption expenditure will increase, and consumption expenditure illicit cigarette also increase, and smokeless tobacco consumption increase or decrease, but consumption of other goods and services also increase. overall household consumption also increase. So what we found, the consumption expenditure of household will increase in terms of rupee. And then again, there's an argument when we increase the taxes, the tobacco grower will affect, and then the industry overall will affect, and there's employment in industry will decline, and that's true. If we increase the taxes, there's a decline in employment in the tobacco growing, and there's a decline in employment in the cigarette industry. But simultaneously, employment in other sector will increase. And the magnitude of employment generated in other sector, because there's a demand for other goods and services, is such a high, it's contributing to overall employment in the economy. So the bottom line is that when we give such a kind of shock, there is an immediate decline in employment in industry. But simultaneously, because there's a demand increases in the other sector, this factor move to other sector, and that's why overall employment in economy will increase. And as the overall employment increase, there's a positive impact on household income, intermediate consumption, value added, and total output. So in a nutshell, output increased 0.03% in the economy. Now, what is the bottom line? What will happen if we increase taxes on to 70% of the retail price? It would result 32.5% decline in consumption of cigarettes, 102% increase in tax revenue, which is more than double, 7.8% decline in road tobacco output, 32.4% decline in cigarette industry output, 13,000 jobs lost in the tobacco sector. However, 322,000 new jobs created in other sector, which is much higher than what we lost in tobacco sector. And instead of decreasing GDP will increase by 0.128%. So what this indicates, it's give a win-win situation. Not only this reduces the consumption, but it also increases the size of GDP. And it's also giving a healthy population as well, because the burden of disease is likely to decline. The key messages are overall impact on macroeconomy in terms of income, value added and output are positive, though small in magnitude. Therefore, raising excise tax to 70% of the retail price would not adversely affect the economy. And the policy implications are a substantive increase in the FED is needed to reach the widely accepted benchmark of an excise tax share of 70% of the retail price. This would make cigarette less affordable and discourage demand for cigarette, and would also result in other macroeconomic gains. A substantive gap exists between tax applied to low price and high price brands. It is recommended to move forward with a uniform FED rate for all cigarette brands. This would help in reaping the benefit of the price in line with the results of the study. Thank you very much for your consideration to listening to this talk on the impact of taxes on the macroeconomy and consumption of household. This is a joint effort of SPC team. It was supported by the University of Illinois, Chicago. My other team members are Muhammad Asif Iqbal, Wasim Salim, Naveed Amir, and I'm again thank you for your consideration to listen to this talk. Thanks.
Thank you, Dr. Sabir, for sharing some of the economic implications of taxing cigarettes. And it brings to the close our topics for presentation. But I wanted to open the floor for about 10-15 minutes that we have remaining today for any questions that people may have from the audience about the various things that we've talked about today. So I don't know if we're able to get the speakers online. Whoever's with us at the moment, if they can join us online. Okay. We do have a couple of questions here. Somebody has raised the issue of supari packets. It's Dr. Sohail who's saying that they're just as menacing, but because of their social acceptability, there's a perception that they don't contain any addictive substances, whereas in fact most of them do. So I just want to open the question to the floor that what have we achieved in our campaign in terms of public understanding and sensitization of the harms of smokeless tobacco and cigarette smoking? And we can start with Dr. Zia before we get the others online.
Yeah, Dr. Saima, thank you very much. Yes, definitely. This is the aspect we need to get the support from civil societies and those working for the tobacco control. That this is ongoing advocacy and literacy. They need to give this information that these other than smoking cigarette, these kind of siparis and all these they took as a norm of the society. They are not the norms of the society. Actually, it's is harming the society. So and also this is the area where we can get support from the our media partners, media workers. I mean, those working for the journalism to give strong advocacy support to write about the harms of tobacco use, whether in the form of smokeless or in the form of cigarette. Yeah. Melissa, would you like to give some comments?
Yeah, we can invite Malik Saab on as well. Unfortunately, we have to do it one by one. We can't have everybody on at the same time. So I'll invite everybody who's in waiting in turn.
Okay. So can I answer now?
Yes, please go ahead, Malik Saab.
Yeah. So as Dr. Zia said, there is a strong need to sensitize not only the masses but also the policymakers about the impacts, the health impacts of both cigarettes and smokeless. When these issues come up by saying that something is less harmful and something is more harmful, these issues are deliberately propagated by the industry. We have seen that during this at the initial stages of corona, when it was spreading, we had this news coming from the tobacco industry that cigarette smokers are doing better against the COVID. And I mean, these researches or statements or things that, something to be good about smoking or less harmful comes from the tobacco industry. And when it comes to smokeless or other forms of tobacco use comes, because they are always under the radar, they are never in the media, their prevalence is not well understood by the policymakers as well as the media. Always, generalize it. They never show it in a way that is more harmful. We see our dramas where people are frequently using smokeless in our dramas, because they think that this is not covered by the tobacco control laws in Pakistan, and that is why the impression is that it may be less harmful than cigarettes. But we see, as Dr. Kamran was saying, and their studies have revealed that everything is equally harmful, no matter what. Tobacco use is not good for human health, and as other speakers have said, they are not good for the economy as well. Thank you.
Thank you, Malik Saab. And I just want to invite Professor Shahzad Ali Khan, who's online with us, to share some of his comments as well. Professor Shahzad, your voice is breaking up quite a bit. We cannot understand what you're saying. Okay, so we'll just turn to Sabir Saab, who shared a very detailed description of the economic implications of tobacco taxation. But I'm interested to know, should we not be emphasizing more on awareness? Why should we focus all our energies on taxation when if people knew that they don't want to smoke, then they wouldn't smoke at all?
I'm an economist, and for economists, the money matters. So, what I'm trying to say is, if you really want to discourage anything, you have to think about e- economic mechanism. And for the economic mechanism, the awareness thing and all these things matters. But what more important is the taxation. And I see there is asymmetry between the
We're having some issues, Sabir Saab, with your voice quality at the moment. It may be because of an internet issue at your end. Okay, so because we're having problems with that connection, we're going to turn to Shariq now and ask him the same question. Shouldn't we sensitize the public more rather than worrying about taxation?
So basically, what needs to be done is, a two-prong strategy needs to be, considered. Something that you would want to make or generate noise about, you would want some sort of a policy demand on ground as well. So it is a proven fact that, if you increase the prices or put taxation, heavier taxation on tobacco, it will eventually discourage the youth. But to make them understand of the fact that this is bad for you, it is very important to constantly generate noise on platforms that the youth are using. You see, for us, we've always considered smokers as victims, but basically it is more about the initiators, the kids, or the 1200 kids that are taking up tobacco products every day in Pakistan. And this is quite an old study, so the number must be really big now. So it is important that we considered both strategies, to go forward.
So I just want to invite Malik Saab back on and see if he has any last comments on this question before we move on to another question.
Adults who know that there are harms of smoking tobacco, but they are now addict and they cannot stop it. But there are other generation that we are now focusing on, and that is the people who are below the age of making decision, like 13 to 16 years. I mean, they don't understand the harmful impacts of these products. They cannot decide in a better way. And this is where the taxation comes to play. So if we increase the taxes, we say that this will reduce the affordability to the children, and there will be less consumption and low, increase in the potential smokers. And when you have that, you will see that the consumption will dramatically decrease because there are no smokers coming into the pool of the smokers, and eventually it will die down. That is where the taxation plays a role. But definitely, mass sensitization is another aspect of it. And
Thank you, Malik Saab.
ones are
So,
not smoking around them. Thank you.
Okay, so just moving on to the next question, which is from Dr. Abdul Shakur. How effective are smoking cessation helplines? Do they exist in Pakistan? And why not put a little bit of energy helping those people who are already addicts? It's a little bit similar to our previous question, but is anyone aware of any research in the effectivity on providing helplines to reduce overall tobacco consumption? If we could please start with Dr. Zia.
Thank you, Dr. Sama. Unfortunately, there is no cessation line available in Pakistan. Although this is very important intervention for giving support to smokers already hooked on smoking. But we see the experience of from other countries, which is utilizing the quick line services or cessation helpline services. It seems a very important aspect of tobacco control, and unfortunately, this has been missing in the Pakistan tobacco control work. So I strongly recommend those who can work for the tobacco cessation, especially for the creating these quick lines. Yes.
Thank you, Dr. Zia. Malik Saab, do you have any comments on this? And then we can ask Shariq.
Sorry, Dr. Saima, because of the internet, I couldn't listen to the question. If you can repeat.
Apologies. The question is about smoking cessation helplines and their value in reducing overall tobacco consumption, and particularly their effectiveness in Pakistan, or potential
Absolutely.
effectiveness.
Absolutely, thank you. And I think this is this could be a game changer in Pakistan at the moment. I mean, whenever you meet a smoker, anybody who knows that the harmful effects of smoking, they want to quit smoking, but they don't know where to go. It needs a lot of other factors to make sure that person quits smoking. And the helpline in this way can play a very crucial role in order to make sure that the smokers know that
Okay, well, sorry about this, Malik Saab. Your line is not very clear. So we'll just turn to Shariq and see if he has any thoughts on this issue.
Yeah. So it's raining in Islamabad. Maybe that's the reason behind the internet's bad connectivity. What we are planning on doing is for our next year, we get quite a lot of questions regarding the same thing on our social media platform. So we don't have a call center or anything of that sort, but people do usually come up to us and they want to find out a way. And we are planning a strategy, and hopefully with Dr. Saima and Dr. Zia on board next year, we will be able to design something where maybe not through calls but online people can get help in getting some sort of support in this regard when they want to quit. We should be able to help them out as well. So that should be something that we should all look forward to.
So the take-home message that is definitely worth considering and investing time and energy into this area. It has paid dividends in other parts of the world to help smokers, and certainly to help them not feel outcast as well. So the next couple of questions, I want to try and include everybody who has spoken with us one more time. I know we're having some internet connectivity questions, but we have had a couple of questions on tobacco consumption again. that what is the main hindrance on implementing tobacco taxation, and what can we do to overcome it? And also, to complement that question, will tax rises actually create jobs? And this is particularly for Sabir Saab. And what is the methods behind this? So what kind of jobs would be created, and how can this be put in a more positive light towards policymakers? So I'll first ask Sabir Saab to join us and see if the connectivity will allow him to answer the question. I'm so sorry, Sabir Saab, we're having an internet connection problem at your end. Perhaps you could share a couple of lines in the text and I can read them out for you. This is one way we can get your message across, and any of the other speakers who may like to do that. Dr. Zia, what are your thoughts on the main hindrances to the implementation of tobacco taxes and how we can overcome them from an expert perspective? And then we can ask Malik Saab as well.
Thank you, Dr. Saima. I must say this is not only related to tobacco taxation. It is actually we can say it is about tobacco control in Pakistan. Basically, we are lacking political will, political support on tobacco control in Pakistan. And I used to say tobacco control is like orphan in Pakistan. Government is not giving that support or priority for you see, tobacco control advocates for last many years crying, shouting, and demanding government to have increase the taxes, impose health levy, and they have already presented the brief and the benefits of having tax levies. I mean, in the time when all the commodities prices are increasing, and only government is not seeing the tobacco as an important resource for getting their revenue, if they are not considering the health aspect. So this aspect of tobacco industry's powerful influence on the higher corridor, I mean in the power corridor, is very important, and then we must consider the strategy, and we need to prioritize our policies and thinking how to get it conveyed to government and higher officials that tobacco taxation is very important for the sake of economy of the Pakistan, because on one side we are spending 5 times higher in the tobacco, I mean treating the tobacco related disease as compared to we are receiving in the name of tobacco taxation. Yes, Taxama.
I'll invite Malik Saab if he's still with us.
Thank you, Dr. Saima. Yes, as Dr. Saab has said, it always need a strong political will, and we see that we had been fighting with the main institution that decide about increasing taxes on any product, which is I'm saying is FBR, and it took us many years to convince Federal Board of Revenue that increasing taxes consistently would definitely increase revenue, and I am happy to say that FBR is now very much supporting additional taxes on tobacco products. The hindrance that we are seeing is at a political level, at a level which is way above Federal Board of Revenue, and we've seen that the resistance is coming from there. I will give you one example of Health Contribution Act, which is otherwise known as Health Levy Act. And it passed all the tests. It gone to the Minister of Law. It passed the cabinet. Everything was there. But then, because there was some pressure coming from from the top to stop it, and we see that it has been stopped for a very long time. I think it's almost 3 years that we have not seen this law, although being approved from everywhere, has not been presented to the parliament. It is still stuck. So again, the main hindrance is coming from some vested interests that are represented at the cabinet level. And if we can convince them, and we are trying to do that, as Indus is also working towards that, to make sure that some sane people should listen to the calls from the civil society and the health experts, then it will not be difficult. All the institutions are for increase in taxes, except for a few one, and we hope that they will listen. Thank you.
Thank you. So just to say that Sabir Saab has made a note in the Q&A box in response to the question on job creation, that additional tax revenue will translate into more government investment and investment crowding. So new jobs will be generated privately as well in the economy. So I don't know if we want to give him another go and see if he can, if Sabir Saab, if you're able to connect with us again. Oh. Unfortunately, it's so distorted. So I'm terribly sorry, and I'm really glad that we were able to get your presentation pre-recorded, because the line was very bad. But I really appreciate your efforts. I want to ask Dr. Zia to please start wrapping up today's session, because we're already at 1:15, and we've had a really lively discussion. Dr. Zia, what are your thoughts as we wrap up?
Yeah, I mean, thanks to our panelists. I mean, it was a very informative session to get to know about the background of Pakistan health situation, as explained by Professor Shahzad of HSA. What is the situation and how much we are spending on health? On the same time, I mean, we have seen the presentation of Kamran expressing the burden of smokeless tobacco. Smokeless tobacco, people commonly don't take as an issue or as a problem, but as a matter of fact, today we knew that this is very important, and it's alarmingly increasing its burden, not only on the health side, but on the economic aspect is also going to be bombshell. I mean, if we couldn't do anything to stop this. Tobacco control policy, the most important aspect of tobacco control, I mean, the Malik Saab has very rightly pointed out the deficiencies and then the gray areas of tobacco control in Pakistan. And for the last more than 2 decades, we couldn't have a strong, I mean, we couldn't identify or decide what Pakistan has to do. Although Pakistan has signed and ratified international treaty with World Health Organization as Framework Convention on Tobacco Control. And according to that convention, to which Pakistan is a member, we have to have this well-equipped tobacco control policy. So this aspect, I mean, we recommend from this forum that Government of Pakistan should consider to launch or develop a strong tobacco control policy to prevent those deaths which are taking place daily from the use of tobacco around the country. Social media is a very important tool, and unfortunately, it's not being used by the government side for spreading good information and countering the wrong information, especially with regards to tobacco control. I haven't seen any government official social media discussing about the harms and hazards of the tobacco use. The last but not the least, tobacco taxation is very important aspect, as Article 6 of FCTC itself emphasized the need of higher taxes, not to increase the revenue, but to discourage the smokers, and also to discourage those who haven't started. I mean, our youth. Pakistan is luckily having 60-65% of youth. If we could stop them not to use tobacco or smoking at this age, research has proved that if somebody has started tobacco use or smoking in the teenage, they will likely to continue to rest of their life. This is what tobacco industry take them as a replacement smoker. So in the end, I'm thank you very much for all panelists to share their valuable research and studies and giving their time. Thank you very much.
Thank you, Dr. Zia, for that wonderful sum up. And we are so short of time now. I just wanted to thank all the speakers for taking time out to make recordings and to share their thoughts live as well. I'm sorry for some of the confusions about the recordings as well, but I'm glad that at the last minute everyone got to share their thoughts. I hope that it has highlighted to the medical audience that is with us the importance of thinking beyond the bedside and the clinic room, and understanding that the bigger picture involves taxation and multiple other stakeholders who are involved in this really hazardous habit that we have in the form of tobacco, and that is not just smoking tobacco but also smokeless tobacco. So thank you very much for your time and attention, and look forward to further conversations on this particular topic. Thank you.